Good evening. I'm Muriel Bowser. I'm the mayor of Washington, D.C. I'm joined by members of my cabinet, including the Department of Health, the Department of Forensic Sciences, and D.C.'s Homeland Security and Emergency Management Agency. I acknowledge the presence of Councilmember Vincent Gray, who chairs the Council's Committee on Health. I'm here to provide a briefing on COVID-19 and its presence in the District of Columbia. Late this afternoon, testing at the Public Health Lab at the DC Department of Forensic Sciences yielded the district's first presumptive positive case of COVID-19, more commonly referred to as the coronavirus. To date, the DC Public Health Lab has monitored 11 patients. 9 of those came back negative. 1 is pending. And late this afternoon, testing yielded a presumptive positive result. Here's what we know and what we can share at this point about the presumptive positive case. A man who's in his 50s is a DC resident, started exhibiting symptoms in late February. He presented and was admitted to a DC hospital on March the 5th. At this point, he appears to have no history of international travel and no close contacts with a confirmed case. He remains hospitalized. With his test yielding a presumptive positive, DC Health has started its investigation in keeping with the CDC's guidelines. This investigation includes contact tracing and providing guidance on next steps for care. As has been reported, we are also aware of people who visited DC and then tested positive for the coronavirus outside of DC. We have been notified of an individual who stayed in DC before presenting himself to a Maryland hospital and then tested positive for the COVID-19. DC Health is conducting contact tracing of that patient and individuals of known contact. We are making our best effort to work with the health departments of states where patients test positive to understand if there was any exposure in DC. As you know, over a week ago, I signed a mayor's order that directed funding and personnel to monitor, prepare for, and now respond to the coronavirus. Our message to DC residents continues to be, help us present the spread of germs and stay informed. We established an updated coronavirus.dc.gov, with the latest information and guidance. Based on CDC guidelines, we're going to keep repeating some of the most obvious and impactful things we can do, including multiple times a day, wash your hands with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Avoid touching your eyes, nose, and mouth with unwashed hands. And of course, stay at home if you are sick and call ahead to a healthcare provider if you believe you are displaying symptoms. With that, I'm going to hand it over to Dr. Talwalkar, who is our Senior Deputy Director at DC Health. Then we will hear from Director Rodriguez, who leads DC's Homeland Security and Emergency Management Agency.